yourself a little bit and talk about your medical practice and history?
Sure. Hi, everyone. My name is Jean-Claude Naret. Let's start from the beginning. First, my education. I actually went to University of Florida for my undergrad. Go Gators. I specialized in microbiology, so I was pre-med back then. But I did take a sabbatical for about 6 years. I just wanted to take a break from the education. And I was lucky enough to work for a pharmaceutical company. And the reason I say that is I learned so much what goes on the other end, and we'll talk more about that. After 6 years, I knew I was ready to continue my career, so I did go to medical school, the osteopathic medicine in Miami, Florida, where I did 4 years. And after the 4 years, I went to NYU Downtown Hospital, where I did my allopathic, or my MD residency as an internal medicine doctor. It was a great experience up in New York. Fortunately or unfortunately, I was located about 2 blocks away from the Twin Towers, and I was there during 9/11. And the reason I say fortunately or unfortunately, it was fortunate that we were there because we were the first one on the scene, so we were able to help a lot of people. Once I finished my internal medicine, I actually came back home in Miami, and there I started to work in emergency rooms. And one of the main reasons I did that is I knew traditional medicine was not for me. I felt after doing like 6 months of internal medicine, I was not really helping people. I was managing the disease. I was writing prescriptions and not really impacting on their lives. And throughout my research and my reading, I really found functional medicine, which is what I devoted the rest of my 18 years in studying. And since this is medicine of tomorrow, I'm still studying and taking tests every single year for functional medicine.
Okay, so since you brought up the functional medicine and that's what we do in our practice, what is functional medicine for you?
Yeah. For me, functional medicine I believe, is the real type of medicine. We fix people, we don't manage their disease. And just to give an example, every day I see patients that have multiple of doctors in their lives, but yet they're still sick. When I do my detailed evaluation that we do here, they still have high cholesterol even though they're on cholesterol medication. They still have sugar problems even though they're on medication. Functional medicine looks at the root of the problem, so we do very specialized testing, and we're able to see what it is the real problem. It's not all about giving a prescription, but if I'm able to look and find the problem, then we actually fix the patient. And most importantly, that's when the patient feels 100%, and the older that they get, the healthier they are. Unlike traditional medicine, I'm sure a lot of the people out there have seen their parents or grandma. The older you are, the more medication you are, and most likely, the worse that you do feel.
Mm-hmm. Okay, so today's topic is going to be bioidentical hormones, which is what we love to focus on here. What are bioidentical hormones, and what's the difference between bioidentical versus other hormones?
Okay. So there's a couple main difference. Bio in biological means from a living source. Identical means that the chemical structure that we have in our body is identical to that. And hormones are chemicals that communicate between the end organ and your brain. Mm-hmm. So let's give an example. When someone needs hormones because you are in menopause or andropause, traditionally we use birth control pills or things that are synthetic, things that are called Premarin. People don't realize Premarin means pregnant mare urine. They actually get hormones from a horse's urine. I don't think anyone has to be a rocket scientist to figure out, hey, maybe this is not for me. You don't look like a horse, you don't talk like a horse, why do you have that? And really, I think what we do is so easy. We replace what the body needs naturally, and we check the balance, make sure it's not too much or too little. That's how you're gonna stay out of trouble. When we talk about bioidentical hormones, it's mainly made from plants or the Mexican yam. It's actually processed in company pharmacies that are legalized to be able to do this, and the chemical structure at the end looks identical to yours. I think one big thing, I also think that this is safer, is we make the medicine for you. Versus if we think of traditional medicine, there's 5 milligrams, there's 10 milligrams. I hope you fit into both. I can make anything I want. 2 milligrams, 15 milligrams, 18 milligrams. I think that's very important because everyone's body is different. Your metabolism is different, your liver is different. So we spend a lot of time finding out, can your body metabolize this? Can your body eliminate that? It's not just all about giving a prescription. And I think, and the second thing is we check the levels. And it sounds pretty basic. Wait a minute, you give something and you check the levels, but guess what? Traditional medicine, whatever hormones that they give, they don't check the levels not once. And by hormones, I mean birth control pills or things like Premarin and other synthetic hormones out there. Not one time your doctor will ever check that. And that's one of the reasons that you do have so many side effect profile from those synthetic hormones.
So what happens to our natural hormone levels as we age, and do we need to pay careful attention to hormone changes?
Oh, absolutely. I mean, first, the hormone aspect is about 20% of what I evaluate when someone comes into the practice. But it's very, very important. As we discussed, hormones communicate between the organ and your brain. If you don't have the hormones, your brain does not know that your body is breaking down. So it really depends on the stress levels. You know, how bad were you when you were young? Do you eat well? Are you overweight or underweight? And are you on certain medications that could affect your hormones? But in general, once you hit the 30s, 35 or so, in medical studies, it shows that your hormones does start to decrease slightly. Some people much quicker than others, again, depending on your stress level, how you eat, and how you exercise. And the goal is to be able to analyze that and to have the knowledge and the background and the education to actually fix that patient and then treat them with a very personalized medicine, which is what we do at Bellissimo Medical.
Okay, so we briefly hit around the age that it starts. So in women, it could start around 30. What are some of the common symptoms of hormone imbalances and deficiencies, and how do they differ in men versus women?
Okay. That's a loaded question.
I know, it's a lot.
And by the way, I see that it's not an age thing. So, you know, God did not give us the same amount of hormones for everyone. I see a lot of patients that come in from the primary medical care doctor, which refuse them to check the hormones because they're 20, because they're 30. I've seen patients in full-blown menopause in the early 30s, menopause in the 30s. So sometimes it's because God never gave them the right amount of hormones. Sometimes it's because they need to detox. There's a problem somewhere in their system. So we tend to look again for the root cause of the problem. So because of that, the signs and symptoms of hormonal imbalance are pretty wide, depending if you're 20 or depending if you're 60. But a lot of times I see the most common ones is changes in your hair, which is very important in a woman, becomes thin, a little bit hair loss, changes in skin tone, lack of elasticity, sometimes hyperpigmentation or spots on the skin, weight gain, very important again for a woman. It's just not the metabolism, it's just a lack of the hormone balance or the orchestra inside in your brain. Short-term memory, you know, being agitated, insomnia, anxiety, depression is very important. Even blood pressure. Blood pressure is not, if your doctor diagnoses you with blood pressure at 50, you do not need blood pressure pill. You need someone to find out what is wrong. And believe it or not, 2 ways I treat blood pressure. The most popular one that I use for business professional people is treating the brain. You know, we all are under stress, we're all working a lot. If you treat the brain naturally, the blood pressure goes back down, and they were able to get off the blood pressure medication. And the other one is balancing the hormones. It's not only about the hormones it's obtained from the ovaries or the testicles, but also balancing the hormones from your thyroid, hormones from the adrenals. Cortisol has to do with hypertension. Again, looking at the cause, then fixing it. Because if you do not do that, you are going to constantly have other diseases. Blood pressure is the first one, then cholesterol, then diabetes, then overweight, then you're going to be on an antidepressant. So we want to stop that, because our goal is to have patients that are with me for the last 15, 18 years. They're on absolutely no medication. They take a handful of natural supplements, but they are on no medication. And that's the goal. If you're not on synthetic medication, most of the time you feel great, you're able to travel and enjoy life. And that's the whole goal, right? Is to enjoy life once we retire.
So what options do we have for bioidentical hormones? I know in office we have pellets, creams. You want to talk a little bit about those?
Yeah, absolutely. Everything is personalized to who you are. As long as you talk about hormones, we do everything. We specialize. I believe we're the expert in hormone replacement. The bioidentical creams we use a lot. It depends for who. I normally give patients the option, but a lot of times I recommend the creams for someone that's younger, maybe in the 20s or 30s, that have a hormonal imbalance. It is made by hand. It is applied on the body, on the fat area, once or twice a day. But it's very friendly, meaning that you could increase the dose, decrease the dose, or stop it if there's a problem right away, because it's a cream. The more popular form that people come and ask me is using the pellets. The pellets is nothing new. I know your primary party thinks is a new, but the bioidentical pellets have been around in the United States since 1935. We were the ones actually that we invented the pellet. So we know the most about that, the delivery, how it's made, where to put, and so forth. So the pellets happens to be much easier for most people. You place them underneath the skin, a very simple procedure done in the office, and once you get going, it could last up to 5 months, and you do nothing about that. Now doing your homework is important. Eating well, exercising, and so forth, in order to complement the hormonal treatment.
Okay, so here's a big question: are bioidentical hormones FDA approved?
And I know even my colleagues are mentioning something else, but they are FDA approved. There are some bioidentical hormones through the pharmaceutical companies. They come in the form of patches, and again, there's like 2 dosage. 2 milligrams and 4 milligrams. The patches have never been successful here because Florida is hot. You get irritation and so forth. But the whole goal, you have to personalize the treatment. It's not just about just giving that, and you need all the 3 hormones to work 100%. So they normally have estrogen bioidentical patch, but they don't have progesterone or they have testosterone. You still lost the boat. You still gave that patient another imbalance. So it really has to be all 3 hormones placed together, and you cannot leave the functional medicine part. I know now there's a lot of places that will do bioidentical hormones, but if you're not properly trained and you don't know how to balance the 3 hormones together, you're not going to be successful. And it's also the 80% of it is vitamins, minerals, nutrition, and it's the whole package. It's not just about the hormones. You're not going to be happy. You're not going to be successful if that's all you do.
Okay, so are there any contraindications to the hormones or side effects?
So the only contraindication is really if you already have cancer. You should go to an oncologist for that. We do support people that have cancer, or after they have cancer and they're cured, we support them with vitamins, minerals, anti-inflammatory, natural pain management. So that's the functional medicine part. But I know there's a bad connotation when you mention estrogen. Oh my God, I'm gonna get cancer. My mom told me, the cleaning lady, or even my doctor. That's just false. I mean, and I'll look at anyone in the eyes, including my colleagues. That is a false statement. It's about the whole picture. It's not just one toxin. It's about the whole toxin. Are you able to metabolize? Let me give you an example. People that have fibroids, or fibrocystic breast, or endometriosis, it's kind of the same syndrome. They have problem metabolizing estrogen. Well, if you have problem metabolizing estrogen, your own estrogen that God gave you can make you sick. So it's not just about the hormones. We go 10 steps past that, and we're able to check, can you metabolize estrogen correctly in your body with a simple test, inexpensive test, and there are natural remedies to that. So it's just more about you're ingesting. It's kind of like saying, if I drink alcohol, I'm going to get liver cirrhosis. No, if you have hepatitis and if you don't know the thing, then most likely. But we have to look beyond that. And fortunately, we do that. And unfortunately, even though there's a lot of misnomer out there, the other option is not pharmaceuticals. At least that's my personal.
So what is the
opinion.
process to get the bioidentical hormones? Are there certain labs or things like that that we need to have?
So first we do a complimentary consultation. I need to, I meet every patient myself. I need to see who they are, what are the goals, even how much fat they have on their body, because that helps me give the right dosage on that. So we do a very detailed interview the first time. We also have a very detailed history form. Some people complain that how detailed, but it's important. I need to know how you sleep. I need to know how active, what kind of job, how many kids, do you have pets, do you have carpet. All that is very important in functional medicine because everything is personalized. I'm not going to give you the same treatment to Maria as I do to Jane. Sometimes it's completely different therapy. And most importantly, when we do our specialized labs and we use functional medicine laboratories, most of them are, believe it or not, outside of the state because they're specialized in functional medicine. It's not all about the local known labs out there. They don't do a very good job in functional medicine because they don't do functional medicine at all. But we're able to, between the interview and the history form, to sit down together and make a good plan for the patient.
Okay. All right. So we basically just summed up everything about bioidentical hormones. We do have a lot of articles of research on our website, so make sure to go to bellissimomedical.com. Thank you so much, Dr. Nuret, and have a great day.
Thank you so much, everyone, and I encourage anyone for a complimentary consultation. You're welcome here at Westman anytime. Thank you so much.